Yeah, welcome back. This is Sunday Breakfast. If you just joined us, you just missed out on an interesting conversation on what first-time parents should know. And you just missed the fact that Jude does not know that you can talk to your baby in the womb. But that's okay. We're still live. We're interactive. Don't forget to send us your messages 0204-447-033. And with the hashtag Sunday Breakfast across all our social media platforms. We're still talking about head and neck, but today cancers. So we're delving into a different aspect, but still with head and neck. And we've been joined by Dr. Zakari Adam. She's a public health practitioner, national coordinator for Young Medical Women International Association of Medical Women Association of Ghana. Doc, it's always a pleasure having you here. I'm sure you heard Jude not knowing about speaking to babies in the stomach. No, and this one, I'll not spare you. I'm going to say it every single time.
I mean, I won't lie, it was quite new to me. But yeah, I mean, that's the purpose of the show, right? To always...
to educate and get to know.
So you should,
now you're educated.
Me that, right? And to be fair, for the past 2 weeks, we've had free lectures from
Doc.
So
on head and neck injuries. And today we're doing head and neck cancers.
Wow.
Yeah. Doc, if
sounds
you could
even more scary.
Cancer is scary because they haven't found a cure for any of it. Any of the cancers that exist, whether your head, your neck, stomach, whatever. Yeah. Let's touch briefly on last week's topic for, those who were not with us or were not watching.
Okay. So I will start with saying that we spoke about spreading odontogenic infections, which basically was delving more into simple toothache causing spreading infections that goes all the way through the neck, can go to the chest region, the head region, and then end up causing a lot of mortality to the patient. So something as simple as toothache, which causes 90% of these spreading infections, can actually have dire consequences. And we were educated on how we can actually prevent us from getting head and neck spreading infections by having to quickly visit the hospital in case we notice that we have any of the signs and symptoms that we discussed at length last week. But I think that there were a couple of questions as well that came in that we didn't have ample time to tackle.
Right.
So I would want to touch on those as well. Sure. So I had somebody asking that, just a moment. I had somebody asking that, good morning, Doc. My 3-year-old has a tongue tie. Is there a need to cut it? So basically tongue ties are when you have, when you raise your tongue, there's this little connection to the floor of the mouth. And usually speech, when you are talking, you need articulators, and then you need what's the name? Controlled air entry into your voice box for you to be able to make speech. You get it? But sometimes some children tend not to be able to talk at the time that they are supposed to. And the reason being that connection, when you raise your tongue, is so high. And that is what we call medically ankyloglossia or tongue tie usually. So in such cases, yes, you can bring the patient to the hospital and then we will assess, and then if possible, just excise it. That could help the patient to start talking. So another was the fact that good morning and thanks for the educative program. What is the cause of bad smell of the mouth? And can that be prevented through brushing? Yeah, so bad smell or halitosis is usually when you have some odor, bad odor coming from your mouth. And 90% of it is from the mouth. 10% is from other areas. Maybe it should be another topic for discussion
that's
for another
halitosis.
day. Yes, that's halitosis. So yes, you need to come for assessment first, and then we would be able to diagnose exactly where the halitosis is coming from. It could even be from tonsil stones. I don't know if you have heard about tonsil stones, where you have, yes, this very bad, smelly stones that form within the tonsils behind the throat. And then this can actually give you bad breath as well. And then another is, hello, good morning. I want to ask if it is important to remove the wisdom teeth if it has not grown at the age of 27.
Yeah.
So I think I tackled this.
Isidore.
Yes.
In Zakari.
Exactly. So I think I tackled this. I spoke about the fact that it depends on what it is causing. So if you have an impacted tooth, it means that the tooth is not, there are some mechanical structures in the path of eruption of the tooth to the mouth. So it can either be the soft tissue or the flesh that we see, the pink flesh that we see, or it can be that it is hard tissue itself, which is the bone. So depending on what it is causing, yes, you can have them removed so that your symptoms subside. The other thing here is, please ask the doctor how much it costs and how long it takes to treat halitosis. So I think halitosis, we need to talk about halitosis the next time. So yes, it can be treated. There are basically 3 different types of halitosis. We have true halitosis, we have pseudo-halitosis, and we have halitophobia, a psychological form of halitosis. So all of these, yes, you would have to be examined, and then thoroughly it can be treated.
Oh, interesting.
The other
Any more
question too
questions?
is that, good morning, doc. I woke up in the morning and experienced pain at the shoulder, and I thought my pillow caused it. So I applied some ointment and took some painkillers, and I still have the pain. And this is more than a week ago. So I'm sure he's trying to say that, oh, maybe I'm doing self-medication. Is there anything happening more sinister? Yes. So in case you have any pain or myalgia within the head and neck region, this, I would say, is more of a musculoskeletal pain, and it can be treated. If you're on the analgesics for about 5 days to a week and you're still not getting any relief, then you would have to come. We can also check the spine to see if there are any problems related to the spine. All right, so I think I have tackled all the questions from last week, and we are ready to delve into today's topic.
Right, definitely. So today we're doing head and neck cancers.
Yes.
First of all, what at all is cancer?
Okay, so cancer, I would say, is, so from our basics, we have a cell, and a group of cells will become a tissue. And a group of tissues, when they work together, they become an organ. And then that organ will become different organs working, coordinating together would form the organism, and then you have the human being. So a cell, which is the basic unit of life or a living thing, has a control center, and then the other parts. The control center is where your DNA is. So that is what helps the cell to grow.
Okay.
And so there is an automatic system within us that help to quickly remove cells that have aged out of the system. So they are able to quickly clear those cells, and then they are replaced by new cells, and then we are able to move and then work as we are supposed to. But the moment you have some risk factors that alter the control center and then cause something we call mutations or changes within the cell, then you tend to have what we call a cell that starts to develop or starts to replicate uncontrollably. So it starts to replicate uncontrollably to the extent that it will populate whichever organ, so much so that it affects the function of that organ. And then it doesn't also only do that. It doesn't only stay confined. Even if it does that alone, we'll be happy. because we'll be able to actually control it. But no, it doesn't stay there alone, but rather it spreads to other areas of your body as well, and then causes malfunction of those other parts of your body. You get it? So I would say that cancer is when you have a cell that has mutations that has caused it to uncontrollably multiply and then cause functional as well as some aesthetic malfunction in general. So when you have that cancer affecting any part of the head and neck region, it can actually affect any part of your body. But today the focus is head and neck. Yes, so if you have that cancer affecting any part of the head and neck region, that is the upper part of the aerodigestive system, which is from your lips, from your tongue, from your mouth, from your throat, from your voice box, where right now we are able to phonate, we are able to talk. There's something at the back of our throat we call the larynx. That is where you are able to generate the sounds from. If it affects that area, or it affects there are spaces within our head too. If it affects those regions, then we say that you have head and neck cancers.
Wow, how about, so that's for your head, or that's for your head and your neck?
Head and neck, yes.
Wow, interesting. I hear people often say that in our part of the world, looking at the numbers again and the statistics, for a lot more people, often than not, cancers are more like a death sentence.
Yes, that's true. Cancers are more or less like a death sentence because of the time of presentation.
Wow.
Usually people, that's why we are here to educate people. People do not know the signs and symptoms of cancers. So they wait and they come very late. And at the time of presentation, anytime you are seeing a cancer patient, you quickly have to do other further investigations. As I told you, it can spread to the lungs, it can spread to any part of your body. So you quickly have to check and then stage it. Staging is very important for us. So you are able to stage it. So you know that, okay, this cancer is a stage 1 or stage 2, stage 3, stage 4. You know, stage 1, and the more the stage, the poorer the prognosis, or the poorer the outcome. So prognosis is the outcome.
Yeah.
You get it? So yes, people tend to come in very late because they don't know the signs and symptoms of it. So you need to let people know what are the classical signs and symptoms of these cancers. What are the associated risk factors? Very important, because all of us are at risk, and we in our day-to-day activities, we tend to come into contact with these risk factors. And it's very important that we know about them. So maybe I should just delve into the risk factors.
I was just about to say, speaking about how do they present themselves?
Exactly. So these risk factors can be modifiable or non-modifiable. 1, age. In the past, we tend to say that people who are older tend to have cancers. But the trends are changing now, because there are other risk factors that are actually coming into play aside the age. The reason for the age is that because you have been in the system for a very long time. So your cells tend to, anytime you have a risk factor coming in, the cell is changed a little bit irreversibly. Then it accumulates until now it is unable to repair itself. Then you see cancer showing up. So 1, age is a risk factor. 2, smoking. I can't underemphasize the role of smoking in head and neck cancers.
Which one? Is it the shisha, the tobacco?
Thank you.
Or the
tobacco smoking. Tobacco smoking. So from cigarettes to cigars to the pipes to the shishas to the e-cigarettes.
How about the one that they say the marijuana?
So marijuana, yes. Marijuana doesn't have a well-documented... No, it doesn't mean that it doesn't cause it. Don't get me wrong.
Yeah, go ahead.
Yes. So it doesn't have a well-documented link between itself and then cancer.
As a risk factor.
Yes. But then once there is smoke, it has that risk. What is well documented is tobacco smoking. And tobacco smoking, now you have cigarettes, and usually there's something we calculate, we call pack years. So it is the number of sticks that you smoke a day over the total number of sticks in a pack, multiplied by the number of years that you have smoked. So the higher your packed years, the higher risk of you developing cancer.
A pack a day.
Yes. So such a person, assuming somebody has been smoking 20 sticks per day, and then you have about 20. Yes. So if you have 20 and the person has been smoking for the past 20 years, so it means that 20 is going to be, the person has 20 packed years. So it means that every day of the person's life, the person is smoking about 20 sticks. And that puts the person at a very high risk of developing cancers in this region. Very, very important. And what I want to emphasize again is not only the active smokers are at risk, but also the passive smokers. So it's likely you may have gone to a pub where people are smoking and you're sitting around people who are smoking.
Secondary smoker.
Secondary smoker. So the secondary smokers tend to even inhale more of the exhaled smoke that the active smokers are smoking. And that is very, very dangerous. So the secondary smoker is smoking the smoke from the tip of the cigarette. One is also smoking whatever that the active smoker is exhaling out. So that is very, very dangerous in the sense that you tend to inhale more of the carcinogens that come. So when I say carcinogens, it means that there are certain factors or there are certain elements within the smoke that can go into you and then cause the mutations or the changes that we spoke about, the irreversible changes within the cell DNA that would then cause the cells to uncontrollably divide. The other thing is that now shisha or hookah, people tend to, we are modern, so we are using shisha or hookah where it is a marketing strategy where you are told that, it is less harmful to the regular or the conventional cigarettes.
And that includes the vapes, right?
Exactly, the e-cigarettes. So it is a marketing strategy. You don't tend to smell it, and it goes through a filter within water that actually reduces the vapor. And another thing is that they will tell you that, they are flavored.
Yeah.
So because they are flavored, it's safe. Let's take it, But that is not it. All of these, the main component is the tobacco.
Right.
And the tobacco, once it is smoked,
that's the
you
nicotine.
tend to have, the nicotine is the addictive substance.
Yeah.
And then you have other additives. So like heavy metals, lead, chromium, nickel, all of these are very harmful to the body. Then you have some volatile organic compounds that also come out of these byproducts of smoking, which can also cause the mutations within the cell. And then you tend to have these formaldehydes and then aldehydes. They are all part of the smoking. And it is these products that come out of these smoke that when you inhale, they do not only cause, they do not only lead to an increased cause of lung cancers, but also head and neck cancers.
Okay.
There's this other thing I've seen, it's in a balloon. I think it's nitrous oxide. And can that also be a risk factor? So
nitrous oxide, it's, we call it laughing gas in the medical, in the medical field, where you use it to do your sedations or your inductions when you want to reduce pain and reduce the state of consciousness of a patient so that you can do a procedure for them. There's no direct link for laughing gas and then causing cancer yet. You get it? Because we use it in the medical field. But I don't know the composition of the one that is commercially used.
Right.
If there are any additives that contain these carcinogens, then it may have
issues.
a risk of causing cancers. You get it. And then the e-cigarettes. It is well documented. Now, the developed countries, they are actually running away from it. Where, oh, it's e-cigarettes, but it contains the same components of the tobacco. You have the heavy metals there, you have your volatile organic compounds, you have your aldehydes, and whatnot. So it is just a marketing strategy that we are buying into, but the basics or the principles are still there, that they will predispose you to getting mutations within your cells, and these mutations will tend to cause you to get cancer. The other thing I want to talk about is alcohol use. Alcohol use, we know that it will definitely reduce your immunity. So it doesn't only reduce your immunity, it also helps whatever carcinogens that you are getting from the smoke to establish itself properly, so that you end up getting the cancer. So the double lethal weapon is actually having smoking
and drinking.
alcohol at the same time.
I can imagine. Wow. Your immune system will just...
Exactly. It actually has 80%, increased chance of you getting cancer than somebody who is not smoking or drinking.
Interesting. Doc, a two-in-one question. Early on you talked about the stages and how it gets more serious when it goes on and on and on.
Yeah.
But even before that, talk to us about the symptoms. Like you said, a lot of people don't even know. And I'm sure the symptoms will be pretty synonymous with some other ailment.
Yes.
So how do you navigate
that? Okay. So before I get to the symptoms, I think I need to mention this. Another very important risk factor is being infected with HPV virus. So HPV is human papilloma virus, especially the subtype 16. The reason I'm bringing this up is now we have different sexual preferences. And oral cancers, oral sex is one of the, in fact, the number one culprits
for the HPV.
Yes, you predisposing your oral tissues, especially your throat, to the HPV. So the HPV will then get into the system and then cause the changes, and then you can end up having, especially the cancers that are related to the throat. So it's very important that we know about this.
But if you have one
yes,
partner,
and then multiple sexual partners.
But if you have one, you're okay.
Yes, if you have one and you're
both faithful
to your to each other. Okay. Yes.
So it is those who have the multiple ones.
Exactly. Or you may have a partner who has multiple sexual partners.
That could also be.
It means that you who is faithful is actually sleeping with all the others. You get it. So that is also one thing I need to bring up here. Very, very important, because it is something that it happens in our daily lives, and we need to be cautious about it. So now, delving into the signs and symptoms.
Before you do that, though, let's promote, the WhatsApp number again, so that if there are any questions that our viewers might have, they would send it in 0204 447 033, 0204 447 033, and also across all our social medias with the hashtag Sunday Breakfast. Yes, Doc, you can go ahead.
All right. So the signs and symptoms, very important. So it could just be a little lump. I think there's a picture. If it can be brought up, it will be very useful to us. So you can have just a simple lump in the neck. A small bump that has been there for like 2 weeks is not going. It could be suspicious. Painless. It's not painful. It's painless. And as Ghanaians, we want to have pain before we go to the hospital. So
it's important. If there's no pain.
Yes. So it's important. Once you see a lump in your neck, is it around the clavicle up here, or is it behind here? Once you see a little lump there, please quickly move to the hospital. It can be a sign of either an infected lymph node, an affected lymph node, or a cancer that is affecting the nasopharynx. So the nasopharynx is a space behind your nose.
Okay.
You get it? So that's the nasopharynx. Another could be that you talk normally, but all of a sudden, there's this hoarseness in your voice. What is happening? You didn't strain your voice, and all of a sudden you feel that when I'm talking now, there's this hoarseness related to my voice. Yes, this is which is unremitting for about 2 weeks. Please quickly move to the hospital. It's likely there is a lesion or a cancer that is developing in the voice box, which is the larynx. Another could be that you feel that your nose or your nostrils are blocked. Not that you have a cold, but it's been ongoing for a long time. Your nose feels blocked, and then to top it up, you have a discharge coming from maybe unilaterally from one of the nostril, which is bloody.
Yeah.
That is also cause for alarm for you to quickly say that, hey, there's something happening. I need to quickly see my doctor. Another could be that you could have a growth. Okay, you could have a growth that's maybe the tongue, affecting the tongue, that this doesn't feel right, which has been there for over 2 weeks. And then it could also be that you have a sore. The sore is not painful on your tongue. That is also a sinister sign that you can pick up. And then a regular swelling, maybe just change in face. Somebody may see you and say that, it doesn't look, you don't look the same. Maybe the right side of your face is looking a little awkward or looking a little fuller than the other side. I always say that the face is the identity of the person. So little changes can easily be picked up if we pay attention to it, because anytime you see somebody and you're interacting, it's the face that you see first. So if there are any little changes, you should be able to quickly pick them up. And then another could be that there's some swelling within your throat, and then some sore throat or pain within the throat that has been there for over 2 weeks. You need to quickly have it checked. It is likely it is something sinister happening. So these are some of the things that could happen. And mind you, head and neck cancers are very difficult to manage. The reason being that their diagnosis could be debilitating to the patient. Not only their diagnosis, but even their management could be very debilitating to the patient.
Is that expensive?
No, in the sense that imagine the cancer affected your tongue and you do everything with your tongue. When you're talking, you need the tongue to move, to make contact with the top for you to be able to make sounds. But in the staging of your cancer, it was staged that, okay, it's an early disease. What is the treatment available? It's to chop it off. Yes. So you see, cancer diagnosis. It is chop. Yes. Also,
you said that so casually. Chop it off.
To chop it off.
Yes.
Is there anybody in this world without a functioning tongue? Is it even possible?
There are people. I mean, there are people who have come in. So that's why I'm saying that diagnosis of cancer in the head and neck is very debilitating, as well as their management. So if, assuming it affects the voice box, and it is staged as stage 2 or stage 3 disease, the only treatment option available is surgery. So you're going to take out the whole voice box.
So the person becomes mute.
She said it so casually, like it's some,
so the
it's
patient,
a normal thing.
Some gearbox in some car.
So the patient will not be able to phonate again, but there are rehabilitation methods of phonation.
Okay.
So now there's something we call the e-larynx, where it's like a talking, an electronic device that you would have to put there anytime you want to talk, and then you talk. Imagine it affects your tongue, and that has to also go with surgery. Imagine it affects maybe your jaw, and that also has to go with surgery. So the diagnosis is very important. Early detection, as I always say, saves lives. And we need to know about these risk factors. We need to know about these signs and symptoms so that we report early. And even if we report early, as I said, the diagnosis and the treatment can be very intense. Wow. So it's important. Smoking, we are always talking about it. Alcohol use, we are always talking about it.
Let me just come back to the alcohol use again. Because for some people, they say people like their alcohol in different forms. Like there
from
are
the
people
spirits to
hard
the
liquor,
wines to the
there are people who are pure alomo, pure gin, like they call it.
No, exactly.
Yeah, and there are people who also like to mix.
Yeah.
Does the form matter really?
Yes, it does. Because you have percentages, and you have the spirits. Some spirits can go as high as 40%. Then you have your wines, which are from 8 to about 12-ish. Then you have your clubs, and then all of that. They tend to be on the lower side. Yes, but there's a quantitative way of qualifying how much.
Dr. Adam, unfortunately, we have to end the show.
Yeah,
so
it's
okay. So maybe I should just end by saying this. So there's a quantitative way of telling how much alcohol you have taken.
Yeah.
So you would have to tell me what type, and we are able to measure. So a tot is equivalent to a unit.
right.
So in the past, it's said that, about 14 units taking about 14 units for a male is normal per week. And for females, about 7 units in a week is also okay.
No.
But now, any quantity at all is significant.
We'll have to continue the